In this morning's Health Watch, now that the weather is getting warmer, millions of children across the country are heading out to play sports. And here with advice on how your kids can avoid serious injury is Dr. Alanna Levine, primary care physician and contributor to BabyCenter.com. Great to have you with us, Dr. Levine.
Great to be
here. As
here.
always. Obviously, it's a great thing when kids go out and play, but what should parents and coaches be looking out for here?
Well, the first thing parents want to know is whether or not their child is developmentally ready to play the sport that you want them to play. So all parents have these dreams of college scholarships and Olympic athletes, but you really want to make sure that your child is at the right stage to start these activities.
I remember that growing up in Minnesota, everyone was playing ice hockey when we were, before we could practically walk, we were already on skates. When it comes, though, to exercise, is there an amount for a child that's just too much?
Well, the American Academy of Pediatrics recommends that limiting one sport to 5 days a week and have at least one day off with no organized sports at all. So it's okay if you want to, throw a ball with your child outside in the yard, but you want them to have some downtime where they're not practicing with their coaches and with their teammates.
We do see a lot of headlines these days, however, about young kids getting hurt. What are some of the injuries children are most prone to when it comes to playing sports and exercising?
So commonly we see overuse injuries, we see contusions or bruises, we see the classic sprains, strains, even broken bones in some instances. Patients come in a lot of the times with concussions from a head injury, and if we're not careful in the warm weather, we can also see heat exhaustion.
That's definitely something parents want to watch out for. These overuse injuries, one of them is called Osgood-Schlatter disease. Let's talk about it. What is it? How do you prevent it?
Okay, so with Osgood-Schlatter disease, typically children will complain about knee pain, and that's caused because you have a growth plate at your knee. And if you look at the animation here, you can see that you have tendons and muscles that insert into that growth plate. And before your growth plate is fully formed, all that excessive stress and shearing forces on it can cause pain.
There's another disease very similar to this one. Is it Sever's or Sever's disease? Sever's disease, which is very similar to this one. What causes it, and how do you prevent that?
So it's similarly, it's the same mechanism. You have a growth plate in your heel, and the more that you have your tendons and your fascia sort of stressed with running and jumping excessively, you can get pain. The good news is for both of these conditions, with ice, with rest, sometimes with Osgood-Schlatter, if you wear a knee brace, that can really help the child. So they usually don't have to stop doing the activity. They may need to rest for a little while, but can ultimately resume. So even if your child learns that they have one of these diseases, it doesn't necessarily mean they're out for the season. Could just mean a couple of practices and some different changes.
Exactly. Let's talk prevention, because obviously every parent wants to keep their kid from having to go through something like this.
Right, so the number one tip I can give to parents is make sure that your children have annual sports physicals before the start of the season. You want to make sure they get the clearance from their doctors. Okay, once you have that, you want to make sure that children are wearing the correct protective gear for whatever sport they're in, and it varies from sport to sport. You want to make sure that your children are doing conditioning exercises. So the first day out in practice, it's not the 5-mile run. You need to sort of build up to that. Exactly. Stretching to improve flexibility is really, really important. And children need to take breaks. You just can't go strong for 4 hours in a practice. And if your child is having pain, take them out to rest, to have a break. That's the hardest thing for parents. They'll come to my office and say, but my child's a star player, it's the biggest game of the season. And kids can support their teammates from the sidelines if they have an injury.
Yeah, and you have to think a little bit more long term, because if you do something mistakenly in the short term, that could really impact the long-term longevity of your child and their ability to play the sport. Dr. Alanna Levine, as always, thanks so much. Great tips, great advice.
Thank you.
And for more of these tips on how to keep your kids safe, go to our partner in health, WebMD.com, and search sports injuries.